Hey guys, Chris here from Lifeline EMS Training. Today we're going to talk about Commotio Cordis. It's a tale of a very poor timing. You're probably asking yourself, why is there a picture of a toilet, a chest, and a softball hitting the chest? I'll explain a little bit more here in a second on why these things kind of come into play with Commotio Cordis. So Commotio Cordis is Latin for agitation of the heart. And what we're going to be looking at here is that blunt chest wall trauma. So things like softball, hockey puck, lacrosse ball, well-placed punch, anything that hits the chest wall. Person even falling down on the anterior aspect of their chest, kind of that unguarded fall. So you think about that elderly patient who doesn't have that uh, good reaction timing and they fall chest first onto the ground, could potentially have this. But really, it's a really small surface area, kind of strategic strike on that chest cavity that provides approximately 50 joules. And it's very similar to the old precordial thump we used to do when a person was in cardiac arrest. Our thought was, hey, take our fist, strike them on the center of the sternum. And the intent was to create essentially like a commotio cordis effect and try and knock them out of a ventricular dysrhythmia like VFib. But for commotio cordis, it's that blunt chest wall trauma, kind of a small surface area that generates approximately 50 joules of energy that takes the heart out of its normal repolarization cycle, and that it essentially triggers early depolarization while the heart should be recharging. So it's a discharge during recharge, if you will. And they find that at about 40 miles an hour for that vectored item hitting the chest is kind of optimal. Anything more, so faster, actually creates damage, creates contusions and structural issues. So it's about 40 miles per hour is kind of that sweet spot for that object or missile, if you will, to be coming at the chest wall and to strike it. Because really what's happening is you're actually stretching the cardiac muscle out, which damages or actually disrupts is a better term, the repolarization or recharging of the heart cells. So if you look over here to the right, you see the normal conduction. So the P waves, the atria, the top two chambers of the heart depolarizing. And then the QRS is the ventricles at the bottom of the heart depolarizing. And then this S to the end of T, that's our repolarization cycle. And the area that's highlighted in red, T wave, that's actually potentially influenced by commotio cordis. So if you're looking at this in the broad scheme of things, a person that gets struck in the chest with a small object that is dense, going at approximately 40 miles per hour, hitting them on this, in this instance, based on the heart rate, it's about 10 millisecond period. That is really poor timing. And what's actually happening is when that impact happens, it creates that stretching of the myocardium and it causes the repolarization to become disruptive. So it damages the recharging. If you think about when you're flushing your toilet, you flush your toilet, so you depolarize your toilet. And then as it's filling back up, right, there's a certain period where you can just keep jiggling the handle, and there's not enough energy that's recharged, in this case, in the toilet water that's recharged. And you're jiggling the handle, and then you get to a point where if you push the handle, you'll get a partial flush. It won't be a full repolarization. It'll be a partial depolarization. So it won't be a full fill. It'll be a partial fill. And that's really what's happening here is it's essentially the toilet hasn't completely filled back up, but it has enough in the back of the bowl that it can generate a flush. So it has enough that it can generate activity. The only problem with that is that activity can be ventricular dysrhythmias. So here's an example of the heart rate of 70. And you look at the amount of time here with the ST segment and specifically the portion of the T wave that can be affected by commotio cordis. And come down here to a heart rate of 116. That area, while smaller, happens more frequently because the heart rate is occurring more frequently. So one of the things to think about is a person who's tachycardic actually has more potential opportunity for that commotio cordis. If you think about the patients we see that are getting struck with hockey pucks and softballs and lacrosse balls and punches, probably in the athletic arena, probably have an increased heart rate from their playing the sport and have that increased potential because of that. So here's that energy impact, hits that portion and triggers that ventricular fibrillation cycle there. And so how do we fix VFib? Well, the best way to fix VFib is defib. Anytime you see that person who gets struck in the chest, or you hear they got struck in the chest and they had a sudden collapse, they went down like a sack of potatoes, you should have a high suspicion of index for commotio cordis. Now, again, this is not a very frequently occurring condition, but this is one of those, very similar to a lightning strike, that if we can get to them early with automatic external defibrillation, we can fix them fairly effectively. Who's the highest at risk in terms of these patients? Well, actually, children are the highest at risk. They have the least dense thoracic cavity. They have the soft, squishy chest walls. So they're the ones that are most prone to getting struck. And it probably also has to do with that they're the ones that are probably hitting and throwing around the 40-mile-an-hour range more than the adults are, where they're, cranking out an 80, 90-mile-an-hour fastball or hitting the ball really hard, or the hockey puck or a lacrosse ball. So what does it look like, right? The person goes into VFib, what do we do? Well, this is just a quick recap, and we would normally be doing compressions during this, but we charge up. You're clear, I'm clear, we're all clear. Shock. And again, we would normally be going right back into compressions, but I wanted you to see what happens underneath with the rhythm change because of that electrical therapy. So that's a quick review of commotio cordis. Not the most common occurring thing, in fact, very infrequent, but it's one that's always on the test questions. It's one you always hear the war stories about at the coffee table. And it's just one of the ones I wanted to hit on to ease the mind. I hope that helped. As always, if you have any questions, hit us up at info@lifelineemstraining.com, and we hope you have a great day.